Hey folks, this is Ray Kober. If you haven't done so already, please click that subscribe button below. That'll help us get better guests and make the show better for you. So once again, click that subscribe button, join us for this journey, and together, let's make healthcare better for everyone.
Get ready to take control of your healthcare. Here's your host, Ray Kober.
Here's what we do, and GoGoMeds came up in the telemedicine space. And when I say that, think of lifestyle medications. So like if you look at companies like Hims and Hers or Rose, the guys that you see commercials for on TV.
Yeah.
We set up all of their back office, like their pharmacy fulfillment and all the white labeling. So when it goes out to the patient, it's pretty in the box. They get their prescription, all of that. So that's where they came up. When we started to see everything with the PBMs overpricing on drugs, that's when they looked at what we were procuring generics for, and we're like, we could be a solution and actually help with this problem. Did they know how was why they kind of reached out to me and said, hey, we need a true sales team now to get into this market, and we think you can help us. So that's where they kind of recruited me. And that's where I jumped in to say, okay, well, how do we figure this out? In the process, with my background, I also gave them the idea of starting to work with direct primary care and concierge medicine groups, just because I knew how quickly that was growing. In my past of working with physicians, it ended up being a good fit too. So we actually work in that space also.
Yeah, no, and I couldn't agree with you more. The DPC space, I believe, is the key to healthcare reform.
Yeah.
Let me clarify that. I'm really encouraged by the DPC movement. I've said it before on the show. I think that getting back to a place where the physician is got a relationship with the patient,
Right.
They're not beholden to, they're not a slave to the healthcare system
Yes.
that owns them, and they can refer when referring is appropriate, but they could handle much of the stuff in-house. So how is that vertical going for you? It's interesting because, I joke with doctors. I interviewed plenty of doctors, and I tell them, look, don't take this the wrong way, but doctors are really good at medicine and pretty shitty business.
Yeah.
So, and they kind of laugh and they're like, yeah, we don't have any training in it.
Right, yeah.
Some of them are very good.
True.
They kind of like learn like, hey, I got to learn this stuff. Others, they delegate and they're like, hey, I want to take care of patients, people.
Yeah.
That's really why I got involved. How is that vertical going for you? Is it growing?
It is. It's growing. So what I knew about the space was just what you said. These physicians are leaving large hospital systems, leaving universities to get back to actual patient care and spending time in the room with their patient, giving them the care they deserve and what they went to school for. They didn't go to school for paperwork and everything else. So what I knew about that was when they left these centers, they also lost that pharmacy downstairs. So they've been reduced to either A, setting up a small in-house pharmacy with a small formulary that then they had to manage, hire people for, manage manufacturer relationships, the list goes on, or they could send it to your local network of pharmacies, your CVS, your Walgreens, your whoever's, and hope that they had the medication, hope that the patient was going to pick it up. Because we have a digital aspect, I've started to approach them and say, hey, we can build this for you to where you just link it into your website, create your own formulary, and you can offer prescriptions that are white labeled now. We'll even put their logo on it out the door, so when their patient gets it, it's part of that, concierge, that white glove touch. And you guys kind of set the pricing. So it's competitive, it's right by your patient, that it's going to get ordered and sent to their door, and it creates a new revenue stream for them because it's all cash pay. So there's no insurance involved, there's no adjudication or going against Medicare, whatever the case is. And they've loved it. They don't have to manage anything. It's just saying, okay, well, I'm going to set my formulary. I'm going to ask my patients if it's something that they want, and if so, I'll send them, to GoGoMeds, and it's white labeled as their name. Or if not, then they go to their standard pharmacy and they pay their insurance rate, and that's fine. But it's been a great option, and it's starting to take off really quickly. We're working with a group right now that's going to go into launch who has about 80 locations across the country, growing into over 100 by the end of the year. So that's exciting for us and exciting for them. But yeah, we're excited by that opportunity too.
So when you say you're white labeling it for the DPC practice?
Yeah, so if you went to their website, it would say, order my product here, or, new pharmacy, and you would click on it and it would be all of their branding. So
you create like a portal,
yeah,
specifically for
it
drugs.
It would be like a pharmacy landing page where you go in, they could price shop it, type in the name of the drug, here's the price, click order to cart. If the prescription already beat it, it'd be waiting for them, and if not, it would prompt the doctor to send that prescription and get linked up and go out the door.
And so, Trace, just so I understand, the audience understands, is this for all things drugs, or is it a microcosm of drugs? Is it an end all be all, or is there got to be some kind of a backstop involved for specialty meds like EMRs, stuff like that?
Good question. So at GoGoMeds, we focus heavily on generic medications. We have access to all of the brands, even the GLP-1s and things of that nature. Our sweet spot is generic medications. So we can always open our entire book and let the physician or the employer group see it and make their decision. Most of the time, it is very geared towards our generic book because that's what we order the most, so we have the most buying power there. So especially when it comes to a specialty product, in my background, most of the time there's going to be some patient assistance needed or a new solution like some of the people that are here this week. So we kind of cap there and focus on the generics where people are ordering 5, 6, 7 drugs at a time because most people on one generic are on a handful, and that's our sweet spot.
Interesting. And so, just trying to still wrap my head around it. So if I'm a DPC provider, and it actually just happened. I'm in the process of finding a DPC provider. I think I have one nailed down.
Okay.
In New York, it's very tough because regulations and rules in New York, Massachusetts, 2 of the worst states. California might be a close third.
Usually.
Right. And it's tough. It's tough for a doctor to hang out a shingle and say, hey, I'm in business. They make it very difficult.
Yeah.
So I think I had an interview with a doc that I think I'm going to call my primary care physician. And the reason that I'm doing this is up until now I've gotten my health care through my wife, who's a speech language pathologist. She works with preschoolers. You know, she does God's work, I say, Trace. You know, she's working with developmentally challenged kids, autism, feeding disorders, really the kids in their infancy, so 2-3-year-olds who intervention at that period of their lives is everything.
Yeah.
And she steps up to the plate every day and delivers.
God bless her.
Really.
That's awesome.
So she actually, we get our health care through her preschool to United Healthcare. And doing what I do, I'm like, what am I, a fucking hypocrite? Like,
It's a tough one to swallow.
I got to get off this train. So her health care just renewed, and I said, take me off. I want to venture out. I'm going to go to faith-based healthcare. So I signed up with Zion Health Share, and they're kind of my backstop. Okay. And now I'm getting a primary care physician. And the reason that I'm doing it is I really became frustrated with the system. First of all, I'm completely disenfranchised with just how things are going. You're basically a cog in the wheel. They run you through the ringer. And your DPC in a traditional healthcare model, your primary care physician, they're going to refer you to within their health system. You're going to pay the most that you can possibly pay, and you're not assured. I mean, although I think my doctor, behaves with my best interest at heart, and I think that's true of most docs. They're under a tremendous amount of pressure to write and prescribe, and tests. And they're paid. They're glorified salespeople. They earn RVUs, relative value units, and the more revenue they drive in their health system, the better it is for them. And I'm sorry, I hate to be a cynic, but that's just the business of the game, right? So I said, let me break away from this, and this month I'm actually going to schedule a meeting with the direct primary care doc. So I go to him now and I say, okay, I have no insurance. Although I do think there is a pharma piece to the Zion Health Share. I want to introduce you to my friend Trace. He's with GoGoMeds. They may be able to help you if you don't already have a pharmacy solution in place.
Yeah.
Would that be a good icebreaker? And then what would he have to understand about kind of where your services begin and where they end? And because putting my kind of healthcare advisor cap on, I don't feel like it's ever my position to tell my client, do this or do that. But it 100% is my obligation for me to be on my A game and tell them where there might be holes or exposure. And I think that's really important. So what type of exposure how would your conversation go with a new doc?
Yeah, and most of the time it's, hey, what are you treating, right? Like, what are you commonly treating? What are you referring out? Like, how much are you kicking out to a specialist if it comes to a Humira or, Skyrizzi's or anything like that? Are you kicking those out? But most of the time, it's just like, hey, bread and butter, if you're seeing patients that are on non-acute therapies, because I tell everyone all the time, don't do those through mail. Like, I'm not selfish. I don't want everyone's business. That doesn't make any sense. Keep doing those walk-up window and getting them same day. But if you have people that are on blood pressure medicines, cholesterols, whatever the case is, that they're doing maintenance medications for 30, 90-day fills, and you're referring those out, those are dollars you could keep in-house. Most of the doctors light up right away because they know that that's primarily what they're writing for.
Yeah.
And they also know that they're sending it right down the road, and they could be keeping those in-house, A, saving their patient money, and B, creating a new small revenue stream back to their practice for doing nothing really. Because it's as easy as just prescribing to GoGoMeds within their EMR system. And then what we do is we take their NPI number, which is their unique identifier, and link it to the prescription of the patient, and that's how we record it to their program. As far as the patient experience goes, it's easy because, A, the doctor just asks you if it's something that you're interested in. The answer becomes yes or no. It's just like if you were to walk in and say, hey, where'd you like me to send your script to? And they tell you about the new program. Okay, we'll send it to, I want to fill it with you guys. Great. If not, they send it to Walgreens. But for them, it's just going back to the website, clicking the link for pharmacy, making a profile, and there's your product. Or if you have some that are already with CVS, Walgreens, a local pharmacy, and you want to price shop it right there on the computer, you can, and then you can just hit the submit, and it'll prompt your provider to either write a new script or us to reach out and do a pharmacy transfer. So it's a pretty easy process, actually.
Yeah, it sounds super easy.
Yeah.
How long have you guys been around?
GoGoMeds has been around since 2016.
Okay.
And again, that kind of all built in the telemedicine space. So we've been building on that back end and buying these generic products to, service those telemedicine clients, digital health, whatever you want to call them. Everyone calls them something different. And then we've expanded verticals since then. So right now, the heavy focus is on the employer groups, and then also DPC. But obviously our bread and butter and something that we've built a big name in is that telemedicine space.
And so you touched on like hims and hers, and I think about the GLP-1s. Yeah. Is that a big piece of your business?
It was for a while. Yeah, we own a compounding pharmacy as well, so semaglutide. I got sick of hearing it every day, quite honestly. But yeah.
He's like, get to the gym.
That, or it's just like everyone and their brother had a new, new startup that they were going to do. But yeah, GLP-1s are still something that we engage in. We can still provide them at brand as well. But when you have services like Novo Direct or Lilly Direct, it's just going to be cheaper to go through them by design, obviously. But it has been a part of our business for the last couple of years. Now that's trickling out with all the FDA rulings on, semaglutide and everything that's tied up, in the courts right now. But starting to fade a little bit.
Gotcha. And so you iterated, is what I'm hearing. Like that was it was a core component of your business. It's still there.
It's still
but
there.
It's not.
Yeah.
It's not as much a focus.
We knew we wanted to make money while we could, but we also knew that we wanted to build our business on something more solid.
Yeah.
Right.
Yeah.
Like we know that employer groups, like there's always going to be employer groups. There's always going to be people on these generic medications, and when we have a solution that we can actually help people, these direct primary cares, that's going to keep expanding. Like those are ones that are going to be around. The GLP-1s, we always knew Big Pharma was going to take that back. It was just a kind of a matter of time and when.
Yeah.
So we joined the trend, and we were able to jump in with semaglutide during those times. But, all the while we were saying, okay, let's make a sustainable business behind this, as we ride this wave.
So the DPC is one vertical.
Yep.
Another vertical are self-funded employers, I'd imagine.
Yeah, absolutely.
And I think that's the primary thrust and focus of Ascend, right? The folks that are here are primarily brokers that are looking for a competitive advantage.
Yeah.
They're frankly sick and tired of the status quo and the system and bringing their clients the same bad news year after year. Yeah, so tell me, Trace, how do you engage employer groups? If you're focused on the self-funded world, are you dealing primarily with TPAs, or is it more brokers?
Yeah.
And what's the pitch to a broker?
So it's both. We work with TPAs and brokers. Most of the time it's TPA through a broker for administration of the actual plan itself. The way that we engage is really a lot of cold outreach until I start to work with people, and then they refer more and more groups back. there's a guy who's probably going to end up watching this, Sims Tillerson, but I do a lot of social media connections and send little direct video messages to people to kind of get to connect and link up that way. But really what we're doing is pretty simple. It's, hey, what are your groups doing in the self-funded arrangement? Can you get me a claims file, and then just let me show what GoGoMeds can do for you? There's a solution for everything with specialty right now, but what we're doing is looking at those generics, and what I'll do is, with my team, we'll take that file, do apples-to-apples comparison, and say, here's what's being spent on generics, here's what we could offer you at a cost-plus rate. Most of the time, it's 30 to 60% savings. That's relative to a group, but for an example, I have an 80-life group, small fabrication shop in North Carolina, that's going to save, they're on pace to save about $36,000 this year. 80 life group, small, employer like that, 36 grand back in their pocket's a big deal.
Sure.
Then we have a 1,500 life group that we're, implementing this, and it's going to be over $100,000 in saving on generic medications, right? Something that people didn't know could be cheaper than they already were.
Right.
So at the end of the day is what we're trying to do is say, hey, here's a gap, because everyone's been so hyper-focused on specialty products for good reason, right? I mean, I get it. It's 80% of his planned spend. But most employees are on a generic drug. So most of the time something is getting filled as generic and it's getting overlooked because, it's just a gap. It's fine. It's an opportunity. So I like to call it.
Yeah.
And then what we'll do is we'll turn around and save it and just make it easy. We're a pharmacy at the end of the day. So again, I can plug into a PBM if they'll let me. And if not, we can go outside of that, make it $0 to the employee. So they, now the company has a retention, recruitment, employee satisfaction tool. And yeah, just try to go from there.
Are you doing any clinical service on the back end as well, or is it strictly the delivery component? Are you looking at whether a medication is appropriately prescribed or not so much?
It goes through all of the stages, right? So when pharmacy, it'll be PV'd 1 all the way through a double, pharmacist checks, especially for controls, because we do controls as well. So, I mean, it's every step of the way. So if there's any intervention that needs to happen, if patients need access to a pharmacist, we have pharmacists on staff for that. So we're trying to provide the full pharmacy service to them. We don't stop it at just getting the medication out the door and saving people money. We try to make it feel as homely as possible, or like a local pharmacy to them. So we try to white label the entire service to say, hey, we get it. It's mail order. It's a little bit new.
Yeah.
But we're still here for you when you need us.
And so as far as a broker is concerned, or baking this into fixed administrative costs when it comes to a plan, are you a fixed administrative cost, or is it's part of claims?
Yeah.
And how exactly do the mechanics work on the back end?
So what I like to tell people too is the cool thing about us is most solutions that you see at the end of the day is if people aren't going to use them, it's going to end up costing the company more money because it's per member per month or startup fees or everything. We're risk-free in that scenario.
Right.
Like I don't charge a per member per month or a startup fee. It's really us just saying, here's what pharmacy should be. You use us, you save money, and if not, you know what you're paying through your plan.
Right.
So at the end of the day, I like to tell people, well, why wouldn't you?
Right.
Like if I can make it that easy, why wouldn't you give these people the option and then, save some money?
Sure.
So as far as baking it in, it's really just baked in savings at the end of the day. There's no additional risk in them paying more for something.
So for a broker, is it really just a matter of plugging your solution into the mix?
Yeah.
And is it plug and play? Is it as simple as that?
It's plug and play. We can go on cycle. So if they want to start at the beginning of a plan year, that's great. If not, I know we're coming into Q4 now. If someone kicked me a file tomorrow and wanted to say, could you get live by Q4? Then what we'll do is prorate savings and say, hey, here's what they're probably going to save in these last 3 months of the year, and then we'll gear up everyone to hopefully have even more enrollment for the beginning of the next year. So we're just, again, pharmacy at the end of the day, so we can go at whatever schedule or whatever pace they want to go.
Very cool.
Yeah.
Very cool.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.